Professor and Chairman of the Physiology and Pharmacology Department at Wake Forest University Baptist Medical Center. Welcome, Doctor.
Good morning.
Well, how is this different than when I was growing up and hearing about Timothy Leary giving LSD and other hallucinogenics?
Well, we were growing up at the same time, and it's very different in that this was a very rigorous scientific study in one of the top-notch human behavioral pharmacology laboratories actually in the nation.
Well, the headline attracted my attention. It says, hallucinogenic in mushrooms creates universal mystical experience. What is a mystical experience?
I think a mystical experience is one in which individuals can have in various settings. It can be highly religious circumstances, but generally it's a circumstance where one feels that one is really communing with something more than themselves.
I could just see the headlines tomorrow from lay people reading this. Is this God in a pill, if you will?
That's really a very interesting question. Even the investigators really talked about it being a significant mystical experience, and these substances, mescaline, which is similar to psilocybin, and even the magic mushrooms, Mexican mushrooms, have been used by Native Americans for some period of time in various religious experiences that were part of their culture.
Now, in reading this article, volunteers, because that's what we should call them, were given this, and about 60% said that this would be one of the top 5 experiences of their lives. That is truly remarkable.
It is very remarkable. Very remarkable.
Is there an area where you can see this being abused, or people reading this article and saying, well, I want to have a top 5 experience and buy some magic mushrooms?
That is really always an issue when you find, or when you're working with substances that have effects upon the central nervous system. And in this case, obviously, there's those individuals that would want to do exploration of oneself rather than scientific experimentation. It's clear that what this is, it's the beginning of a very significant scientific investigation of the actions of psychedelics, something that has never been so rigorously performed.
Do you see this being used in terms of severe depression or in end of life when experiences are low to kind of augment one's consciousness, if you will?
Yes, I think that that's actually one of the first areas that the group from Johns Hopkins wants to actually look at. They want to look at severely depressed individuals, terminal cancer patients, for example, where some type of mystical experience, at least experienced by I believe it was like 70% of the individuals that they tested, in individuals that are terminally ill.
And also we should make it clear that the volunteers did have some effects such as paranoia and anxiety. Can you get into that a little bit?
Yes, actually, during the psilocybin episode, individuals reported kind of a semi-fear, panic, anxiety. So yes, and if we look back in the lessons that you and I are aware of from the 60s, with LSD, for example, there were circumstances where people were using LSD in a fairly frequent basis, and they might have wonderful experiences, and then all of a sudden have a horrible experience, a horrible panic type of circumstance. It's clear that a substance like this can be very dangerous. Anything that distorts the way you're seeing the world can result in panic, and you may engage in activities that may be self-destructive and without even being aware that you're doing it. I was going to say these compounds, we don't know a great deal about the science behind that, and I really believe that this study is the first step in that direction.
Great. Dr. Smith, thank you for joining us. We hope to see you again when the studies continue.